I feel like our generation right now we're on the cusp of something different. We're talking more openly about mental health. We're talking more about our bodies. We're bringing more awareness to our autonomy, and I feel like that is like something teetering on change.
That we have to trust folks to be the experts of their own lives and understand that they have an idea of what they need to do to get out of their circumstance. What they are lacking are the tools.
By having Black women do research regarding Black women, I think the story will be interpreted more accurately than historically.
To be treated as SUD patients, they need to be treated as human beings that have substance use disorder.
I think it's definitely important that we kind of stay at the front lines of this research.
SisterReach is the first reproductive justice organization formalized in the state of Tennessee. We work from a three-pronged strategy of education, policy and advocacy, and culture change work. We work to forward the reproductive justice and human rights of women and teens of color, poor folks, rural folks, gender non-conforming people, including LGBT people and their families. And we have been doing that work now for almost 8 years in the state of Tennessee. But they can at least talk about what a Black experience in that area looks like.
It's very important to spread awareness, especially in the Bible Belt. We grow up where we don't really talk about our bodies. We really don't talk about sexism. It's a very taboo thing in 2019, even though we see it on TV all the time. But I think it's important that we spread awareness and knowledge to let people know of the access that they truly do have. A lot of people just don't know.
That's what SisterReach has been doing. We have been working to center those who are most vulnerable, lift up their voices, making sure that lawmakers know, medical providers know, the community at large knows, and so that we can have a bit better compassion about the ways that we deal with folks. Who else? Like, who's missing? I didn't know it was gonna be this great to help other people. I didn't know it was gonna feel this good to help a woman who was going through what I've gone through. But it is like the best feeling you can ever have to see, your own life reflected in somebody else's life, and it all be positive, right? We're helping people here. In 2014, SisterReach was invited to collaborate with the National Advocates for Pregnant Women, Healthy and Free Tennessee, and other state partners in opposition to a bipartisan-supported fetal assault bill, which aimed to reduce drug usage among pregnant women by threatening them with jail time and loss of child custody.
We did a full-scale research project interviewing women who were directly impacted and women who were potentially impacted by the law. The goal of the law was not met. NAS did not decrease, and folks still used opioids.
Criminalizing those women, it doesn't help our community. And it's my belief anyway that the laws that are passed should be for the greater good. But if you ruin it from the beginning and you imprison that mother, it's a detriment to that child, it's a detriment to that family, it's a detriment to the community, and it matters.
You know, it is like my life's work to get folks to understand substance use disorders as medical illnesses. And I think once we think about the role that the brain and the rest of physiology plays in the development of these illnesses, then it makes it easier to think about policy and advocacy and compassion.
Women are most vulnerable, I think, when they are carrying a baby or in soon-to-be motherhood, and to be associated with opioids, that's a whole nother chapter in the book of a mother.
We really want to bring compassion back into the lens as well. So I'm an ordained minister, and we have at least 2 more ministers on our staff. And what we're also doing is working with faith leaders. We couldn't do this work in the Deep South, in the Bible Belt, without having some Bible-centered ways that we get our work done. And so that is our reproductive justice and faith training. We're going all over the country with it.
And what we do is we talk to community leaders, advocates, pastors, and laity members about how to see the humanity in the people that they serve, And so it's where we ask the hard questions and we have the hard conversations.
So our work is to take it from theory to practice to and strategy to movement building. So SisterReach is a movement building machine.
So SisterReach, it begins on the ground in Memphis, Tennessee, but it extends internationally. Like the effects of our work, it extends. It's like waves in the ocean. It starts here, but it ends, who knows? Yeah.